Good morning, everyone. Taking a look outside, downtown Atlanta. Look at the flags blowing. It is windy out there, but it is also sunny, and we are grateful of that. This is Atlanta and Company. I'm Christine Pilara. I'm so happy to be with you today. So spring is officially here, and while some are really excited about the weather warming up, others are actually dreading it. Maybe you're one of those, because for many, the warmth means wearing clothes that show off unsightly varicose or even spider veins. It's good to know something can be done about it thanks to VeinAtlanta. Here to tell us more is Dr. Louis Provosti and patient Karen Foreman. Welcome to you both.
Thank you.
Well, doctor, it's been too long. Don't be a stranger. So good to see you.
It's good to see you.
Well, I think it's because you've been very busy. This is a busy time of year when we all kind of take inventory and think, okay, here comes the shorts and the skirt season. And Karen, that's why you are here. We want to hear your story about when you really started to see problems and when you decided to go to the doctor.
Well, my problems really have gone on for many, many years. I inherited varicose veins from my mom, so I've always been aware of it. And 25 years ago, there wasn't any way to take care of that except to have your veins stripped.
Right.
And that was a terrifying prospect.
So you knew you had them and you knew they were uncomfortable and unsightly, but you just thought, I don't want to go through that serious procedure. And doctor, is vein stripping still around, or are there many other options that are not as invasive?
Right. Vein stripping is more or less obsolete now. So that procedure,
yeah, Karen's like, it is good.
Yeah.
which for many, many, many years, and really dates back to almost antiquity, was the only option. Okay, but starting around 10 years ago, there's a lot of new technology that has taken it from a unpleasant procedure to now outpatient procedures with minimal downtime, minimal discomfort, and as an extra benefit, a much better long-term results. So it's a win-win situation for the patient.
Doctor, what are we looking at in the video? What is specifically, how is the vein being treated there?
This is a video of what's called radiofrequency ablation, also called radiofrequency closure, and this is one of the procedures that Karen had. And this is the culprit vein. So this vein, blood was flowing in the wrong direction, back down the leg, because of course the veins are supposed to drain blood out of your leg back up to your heart.
Sure.
So that means blood has to fight gravity, and when these one-way valves wear out, then blood pools in the legs and causes the veins to distend and ache, and that causes varicose veins and spider veins and a whole lot of other symptoms. So this procedure, which is done in the office under local anesthesia, essentially replaces the vein stripping. So instead of stripping this vein out, it's basically like starting an IV on the vein, and we close the vein down, which has the same benefit as a vein stripping. Okay,
and Karen, we mentioned one of the symptoms, of course, achy. So not just visually. I mean, of course, I know for many people, we hate the way it looks, but also the way that you feel. And so describe some of the symptoms.
Well, you can't stay on your feet for very long, and you get really tired, and then at night your legs ache when you sleep. So it's just and I didn't realize that it was because of the flow of the blood.
Right.
See, I just figured I was stuck with that for the rest of my life.
Right. Well, thank goodness the doctor came along.
Yes.
And I know, doctor, we've even talked, because my mom has terrible, it worries me so much, varicose veins. I've started with the spider veins myself, and you've, in the office, done the test for venous insufficiency.
Right.
Let's talk about that. Is it possible for somebody to have symptoms but not really see any visible signs, if you know what I mean, right?
Yes, it is, Christine. The majority of people that have venous insufficiency, which may cause aching, tiredness, heaviness, burning, itching, night cramps, restless leg, swelling, and a number of other symptoms, they may not have bulging veins.
Right.
So what's called a venous duplex ultrasound is the procedure, is the test that we do in the office to make the diagnosis, as well as from the history. As in Karen's case, usually the symptoms have been going on for quite a while.
Right.
So yes, it is very possible to have venous insufficiency and have a good solution for treating the problem and not necessarily have bulging veins.
Right. Okay. Yeah. Because I think you said, even though mine looked okay, I don't have anything really big and bulging yet. I had some early signs of venous insufficiency. So, and I had the itching sometimes and the achy.
Yes.
So, you know, that's something to be aware of. You might have a problem, and it's always just best make the appointment. Go to VeinAtlanta.com. There's the phone number, which I'll give you after the segment as well, and just schedule an appointment to get the ultrasound to see. Right, doctor?
Yeah, it's real easy.
Yeah, it was.
The majority of the time, for people that have symptoms or have visible problems, the initial evaluation and the ultrasound are usually covered by standard insurance plans.
Good.
And most of the treatment is usually covered. Now, pure cosmetic issues, of course, are not covered by insurance.
Right, of course.
But like in Karen's case, where she'd been having symptoms for many years, and as Karen's case exemplifies, the #1 cause is hereditary.
Right. Absolutely.
Okay. Usually all of that is covered by insurance.
Good.
Of course, we do a lot of cosmetic spider vein work as well. And for a lot of people, it's combined. You know, there are symptoms, there is the venous insufficiency, but then there is a little bit of the unsightliness.
Right.
And we do have a before and after.
I want to see it. You know, I've been staring at her legs right here, and I know we have even better view so you can see close up at the difference that is. And Karen, before in the commercial break, I was telling you how nice your legs look, and you said that you feel better. And that's key, right?
Absolutely.
Are you still having achy tiredness, or all that's gone?
Most of that is gone, really
Excellent.
gone. And I'm just more comfortable when I walk around during the day, especially if I'm doing something for a long period of time.
Sure. I mean, your legs just look beautiful. Again, it's not just about the physical, that helps, but just knowing that you can be productive and do the things that you want to do without having all the pain is incredible. So.
Yeah, and just knowing that you're doing something about the flow of the blood in your legs
Right.
that have caused you the problem. So,
Right. Well,
and
thank you so much. Anybody who wants to know why they should choose him, what do you have to say?
Oh, I would highly recommend Dr. Bravasti and his entire staff. They are delightful people. They are very professional. They're very courteous. They really seem to enjoy what they're doing. And it's
Good.
just,
I think
it's
so,
a pleasure
too.
to go there, and you know that when you come out, you'll be a lot better off than when you went in.
Absolutely. Well, thank you for being here. We
welcome.
appreciate your time. Doctor, always great to see you.
Good to see you.
And again, if you want more information about Vein Atlanta, call 404-446-2800 or visit the website. It's VeinAtlanta.com.